Hi, I'm Mike Masding. I'm the head of Wessex Foundation School and I'm a consultant physician at Poole Hospital.
Hi, my name's Toby. I'm a Foundation Year 2 doctor at Bournemouth Hospital.
Toby, when you were given a GP post instead of the cardiology post you were originally supposed to be doing, what were your thoughts?
Well, I was quite dismayed, I think, first of all, because I was quite looking forward to doing cardiology. I kind of got used to the idea, and actually after, doing GP for the last 4 months, I've actually really enjoyed it.
And what are your career intentions?
So I'm hoping to do ENT long term, yeah.
So even though you had no intention of working in general practice, you still enjoyed your 4 months there?
Yeah, absolutely. I mean, I think it's been a really challenging placement, and it's given me a better insight into what happens in primary care, and sort of closing the loop really, in seeing how patients go through a sort of journey from admission all the way to being discharged and then sort of being looked after again in the community, and that's really valuable for any specialty, I think.
One of the things that I feel as a head of school is very important is that you guys, see patients on your own and actually really get your hands dirty as such. Was that your experience in primary care?
Definitely, yeah. I think, the first couple of weeks, it was quite close supervision, and once you have a good understanding of how things work, then you're very much encouraged to do things on your own, albeit, you've always got the support behind you if you need it, and when you need it, to discuss patients and management plans, and that's been really helpful.
So you were well supervised. There was always someone to talk to about the patients. 'Cause I know that's what some people worry about.
Yeah, I think it does vary a little bit from practice to practice, but certainly where I'm working in Verwood, there's always someone who you can have a chat with and just run things past. Yeah.
Okay. And what other experiences? There's the conventional GP surgery. What other experiences have you had apart from that?
I've been along to all the practice meetings at Verwood, so getting an insight again into the sort of management side of general practice, which is not something I'd really thought about a great deal before starting, but it's a huge part of it really, and so that's been quite interesting. And we also have a minor surgery clinic twice a week, in fact. So I've been getting involved in that as well, which has been fantastic as well to get some basic surgical skills.
So you've been able to have the opportunity to take your interest and use that specifically within your GP practice?
Definitely, yeah. So it's actually been quite a useful thing to do, even given that I'm going into surgery, to get some of that basic knowledge and basic skills sorted out. Yeah.
And finally, do you think you're a better doctor for it?
I hope so.
I'm sure you are.
But I think it really does help to know what happens in primary care, because at the end of the day, that's a large part of what the NHS does, and understanding the lengths to which GPs go to avoid admissions, and the breadth and depth of knowledge that they are expected to accumulate, just gives you a greater understanding and a greater respect for what it is that GPs do and how they interact and how the system really works. So I think that insight has definitely helped me.
Good, thank you.